Have you ever wondered what IBS is and how to recognize it? IBS, short for irritable bowel syndrome, is a common disorder that affects the large intestine. It's a chronic condition, meaning it's long-lasting and often needs to be managed over a lifetime. Though it can cause discomfort, it's important to note that IBS does not lead to more severe complications like colon cancer. IBS is characterized by a group of symptoms that occur together. These include repeated pain in your abdomen and changes in your bowel movements. And when we say changes, we mean that it could be diarrhea, constipation, or sometimes an unpleasant mix of both. Since it's a syndrome, it's not a disease in itself. Rather, it's a collection of symptoms that consistently occur together. So, IBS is not a disease in itself, but a syndrome that involves a group of symptoms that occur together. Now that we know what IBS is, let's delve into its causes and symptoms. While the exact cause of IBS isn't known, several factors might play a role. Muscle contractions in the intestine, stronger and longer than normal, can cause gas, bloating, and diarrhea. Abnormalities in the nerves in your digestive system may cause discomfort when your abdomen stretches from gas or stool. Inflammation in the intestines, severe infection, or changes in bacteria in the gut can also contribute to IBS. The symptoms of IBS can include abdominal pain or cramping that is often relieved by passing a bowel movement. It can cause a change in bowel habits such as diarrhea, constipation, or both. Other symptoms include bloating, gas, or intolerance to certain types of foods. Remember, the symptoms and causes of IBS can vary greatly between individuals, and it's always important to seek a professional diagnosis. So, how is IBS diagnosed? Well, it's not as straightforward as you might think. There's no specific test for irritable bowel syndrome. Instead, the diagnosis is often a process of elimination, ruling out other conditions that could be causing the symptoms. One of the diagnostic tools used by medical professionals is the Rome-4 criteria. This is a set of guidelines that helps in identifying IBS. Here's how it works. If you've been experiencing abdominal pain on average at least 1 day a week in the last 3 months, you might be dealing with IBS, but there's more to it. This pain must be associated with 2 or more of these factors. It's related to defecation, there's a change in the frequency of stool, or there's a change in the form or appearance of your stool. While managing IBS might seem challenging, it's entirely possible with the right knowledge and professional guidance. Let's quickly summarize what we've learned about IBS. It's a common but disruptive condition affecting the digestive system, characterized by stomach cramps, bloating, diarrhea, and constipation. Causes remain uncertain, but factors like food, stress, and gut bacteria play a role. Symptoms may mimic other conditions, making diagnosis a process of elimination. The impact on quality of life underscores the importance of early recognition and management. Remember, when it comes to IBS, knowledge is power. The more you understand, the better you can manage it.